Welcome back to another edition of the Heart to Heart podcast. And today I have returning guest Ali Gilbert. She's basically the queen of men's health online. A lot of people go to her for her advice on TRT and overall just for her advice on optimizing your health with regards to men in particular. And she's also the founder of Silverback Coaching. So Ali, welcome back to the show.
Silverback coaching. Close.
So wait, I got that one wrong, did I?
You said gorilla back, but it is a gorilla. So
okay, close.
That's okay.
We'll fix that.
Thank you for having me back. It's an honor.
Yeah, so I'm so pumped to talk to you today for a few different reasons. But for the people who didn't see our first episode, maybe you can just tell them a little bit about yourself.
Sure. Like you said, my nickname is Queen of Men's Health. It's not self-proclaimed. And I've been a fitness professional for like 24 years now. And my company, Silverback Coaching, we do men's concierge online coaching. So we cover hormones, nutrition, training, life management, everything.
Sweet. That's awesome. And I definitely want to get into that stuff today. But I know that last time we had chatted, and I remember I forgot to ask you this one question. So maybe I'll just, start there before I forget this time again. So I know there was a while ago, maybe you can tell us, the exact time that you had breast implants, but then you took them out. So why did you take them out?
So yeah, I got them in 2016 and got them out in 2019. So it was less than 3 years. And most people are like, oh my God, did they leak? Like what happened? And they did not leak. Nothing happened to them. But to me, my body completely was like, yo, we don't like this. And I remember I showed actually a friend of mine the photo last week of what I looked like at the peak of inflammation and just like feeling miserable. And that was 6 months after I got them. And I was speaking at a conference, and I remember I was like trying to diet for it and, look good on stage and everything. No matter what I did, I could not lose weight. And I was eating like 1,100 calories. I was doing 2 hours of cardio, like everything to try to knock weight off. And I was like, this is awful. This is miserable. I don't know why it's not budging. And after that followed a bunch of GI issues. I ended up acquiring a parasite, which I don't know if it's related, but it just, everything happened. I got blood work done. My thyroid numbers were like all over the place. And I had never had that happen. And I just felt tired all the time. And I was like, what is going on? And I remember someone was like, it could be your implants. I was like, come on. Like I never heard that before. And so I go online and there's something called breast implant illness. And I was like, oh, this is like a thing. And I was like reading all the comments, and everybody had similar experiences to me, at least everyone in this forum that I was reading. And I was like, oh my gosh, this sounds exactly like what I'm going through. And I just went down a rabbit hole, scheduled surgery, for I went through this process, and I did everything. I was doing blood work like every month at that point, like to see if anything changed. And 2.5 years later, I was like, I need to get these things out. So scheduled the surgery, could not wait, got surgery, got blood work done like 8 weeks later. And then everything went back to where it was supposed to be. It was crazy.
That's insane, especially first of all, like the intuition, and like we will maybe talk a little bit like breast implant illness, because I think that is a legit thing, even though some people try to like dismiss it. But the blood work, that just proves it. Like that's more or less for you anyway. Like that's empirical evidence for at least for you, right? And was it specifically your thyroid, or was it something else that changed, or?
I think the inflammatory markers came down. Mostly it was thyroid, because it just, that gets driven by any type of immune response. And I can't remember what else, but it was wild. And I'm not the type of person to be like, well, this happened to me, therefore you shouldn't get implants. But I just use what happened to me as an educational experience, because several of my girlfriends also experienced it, got theirs out, felt a lot better after. But there's women that have no issues at all and they feel completely fine. And, you're supposed to get them switched out or get new ones every 10 years or something. But my surgeon who took them out said that he only will do explants now. He refuses to do augmentation because of what he's seen with women getting so sick. And he said that there was a black box warning on certain implants, I guess now, which is crazy.
Wow.
Yeah.
That's really interesting. And I mean, part of the reason why I want to have this discussion with you was because my fiance did the same thing. I think around probably like the same period. Like I think she only had maybe 3, maybe she had them for 5 years, something like that, but like not too long. And she wasn't really even getting too many symptoms per se. She was just sort of like afraid that like something could develop, like all of a sudden she could get like an autoimmune disease. And like we know that there's like an autoimmune thing with thyroid. And so, I think it's good for, women to know, like if they do have implants and they're feeling in a certain way and like they're not really sure why. Again, like we're not saying that like, it's definitely your implants. Like, we discussed, you have friends or people who have implants and they have absolutely no issues. But for people who are, in this sort of stage where they're just really not sure why they're not feeling 100%, I think it's something, to look into. And again, I know it's just like anecdotal, but I am like interested in like the other women that you chatted with, like what kind of problems did they have? Was it also thyroid, or was it just more like fatigue or mood issues? Like what was really going on?
All of that, like some were losing their hair, some were developing like skin problems that they never had, like breaking out in rashes and stuff like that. A lot of the big ones were just the fatigue and the brain fog and the inability to drop weight, especially if you're doing the right things. I
Yeah.
mean, and I was exhausting every outlet. Like I did every single test, I did everything possible to rectify it, and nothing worked. So that's the route I took. And like you said, if someone's struggling, you're not going to be like, oh, it's your implants. Like obviously you want to see if it is something else, but it could be, like you said, something driving it autoimmune wise. Like if someone has a history of autoimmune issues, which I did not, but if they do, that's a contraindication to getting breast implants, but plastic surgeons aren't going to tell you that.
Yeah, and I'm also curious too, like you said that you had thyroid issues, like were you offered thyroid treatment?
I've been on thyroid. Like I think I self treated. This is like back in 2007 because everyone took T3 to be able to drop weight. So I was like, oh, I'm gonna take T3. So I like ended up staying on that. But then my
And
TSH.
Ali, just maybe let people know what T3 is, because some people may not know like exactly
Oh,
what
yeah.
that is.
So
Yeah.
T3 is like the active thyroid hormone, and it's the one that can drive fat loss and metabolism. And so bodybuilders and physique athletes take it as a means to increase thermogenesis or fat burning. So I ended up I just took that like haphazardly when I was younger, and so I was already on it, but my TSH like went really high, which I never had before. And that's now back to what we consider optimal or normal. But I don't remember what it was exactly, but like that was out of whack. Like my LH and FSH were all wacky too, which is really weird. So I was like, okay, this is bizarre. Like I was, 30. How old was I? 2016. This is almost 10 years ago. So like 34. And I was like almost perimenopausal, and I was like, this is really fucking weird. So
Yeah, and that's just wild again how like, your thyroid was out of whack and you decided like, hey, like I'm not going to take thyroid medicine. I'm going to get my
yeah,
breast implants out.
went really
Like
extreme route.
yeah, but obviously it worked out. But anyways, yeah, just really wanted to hear about that story, because I know that there's probably some people listening to this who may be struggling with some symptoms, who have breast implants clients who just can't figure out why they may not be feeling their best. And, again, we're not saying that it's, definitely the cause, but, something for sure to look into, because, you're not the only person, I think, who has, experienced these types of symptoms. So yeah, thanks for sharing that.
Yeah, for sure. I'm like an open book with that. And I actually kept them, like I took them home. They're downstairs in a drawer. And I was like, this is fun. And they're just so heavy too. And like I remember the surgeon that put them in, like his office called for like, I think it was a 2-year follow-up. I was like, oh yeah, I'm getting them out. And they're like, oh, what happened? Did they leak? Like, blah, blah, blah. Like they were clueless to like the issues that women had. And they had never heard of breast implant illness, of course. And I was like, don't worry about it.
Yeah, well, hopefully it becomes, less of a controversial term or diagnosis in the future, as more people like you like speak out about it, and as more women, unfortunately may experience some of those symptoms that you and others have experienced.
Yeah.
But yeah, just wanted to get that one sort of out of the way, so to speak, because I know that last time when we chatted, I was like, I'm definitely going to ask you about this, because it was like a week after maybe my fiance got hers out, and somehow I just forgot to ask you. I guess we were chatting about TRT too much, which is one of my favorite topics, and just kind of forgot. So thanks again for sharing that. So maybe, we will get into TRT a little bit there again. And one question that I have for you, I'm not sure if this comes up with some of your clients. I know that, I've had friends that have had this issue before. So it's not specifically on the TRT itself, but they always find difficulty initiating it because their girlfriend or, someone in their family or their wife or something, they're against TRT, or their wife isn't educated on TRT. Like, do you have a lot of men who come to you like that? They're like, man, I want to try TRT, but it's just not something that like my wife is on board with. Like, what can I do to get her on board? And like, do people come like that to you? And what do you say to them if they do?
Um, we get a handful of guys like that. I think just the videos that I've put out and my colleagues have put out have provided like a wealth of information around it. So when that does happen, it's more so I offer to talk to them, but I educate
That's
the
awesome.
guy because I'm like, listen, like it's no different than a woman going on hormone replacement when she needs it. So it just is so stigmatized because it comes in a needle if you're doing injections, and it's a steroid hormone, it's an anabolic hormone, and all these misconceptions and myths that have been floating around. And they think that either he's gonna like become the horniest person on earth and that's gonna bother them. So that's their real reason for being against it. Or they think he's gonna become aggressive and roid rage and all those things that are associated with doing anabolic steroids, which are completely different. If anything, TRT can actually calm some guys down and help them just be more confident. But it is an educational process and an understanding of, okay, well, if they're against it, then they can be preventing you from living a very healthy life, because having suboptimal testosterone can predispose you to things later in life that are not good.
Yeah. I'm just kind of thinking out loud now, like that's a good approach. So like maybe, whoever your provider is, or whoever is, telling you to, get on TRT, maybe just have them come to the appointment with you, so, instead of, just going by yourself to the appointment, like just have your wife come with you, and have the healthcare provider or whoever it is who, wants to initiate TRT, come with you to the appointment. And I imagine, you probably get better results overall that way. Like, have you kind of swayed people when you've talked to their wife before?
Yeah. Yeah. Or if they do see an in-person provider, I'm like, bring your spouse. So that's hugely important. And yeah, I can't say enough, but most of our guys, like, they make their own decisions and then explain later. So
That's good. And then this may be actually a good transition, because I know that, you kind of mentioned that earlier, when guys get on TRT, they often become more calm and more confident. They're actually easier to be around. And so it's less of an issue of like roid rage. It's actually the exact opposite. And one thing that I've noticed that a lot of people, and unfortunately, doctors don't test for a lot, is DHT. And, from my understanding, it's DHT that's the kind of calming component of the testosterone. I believe it attaches to the GABA receptors. And so we know GABA is very influencing on, making us feel calm and just, giving us a better mood in general. And so a lot of people, unfortunately, are on finasteride or Propecia, and they don't know about this. So like, do you ever get guys who come to you who are on finasteride and you're like, listen, like, man, you have no idea what this is doing to your DHT? I mean, they may even not know what DHT even is. So like, is that a big issue for you? You're kind of nodding your head. It seems like it is.
Yeah. Yeah. Finasteride. Because like there are guys who think, oh, well, as soon as I go on testosterone, I'm going to lose my hair. And I'm like, well, why do you think that? And they think, well, I see all these guys who are bald that are on TRT. And I'm like, okay, let's have a discussion around this. Are you genetically predisposed to that? Did your dad lose his hair earlier or whatever? Because if you are, then okay, it might speed it up, but it's not like you go on testosterone tomorrow and then 2 days later you're going to be bald. It just might be a quicker long-term thing, but sometimes they don't have that genetic predisposition. They just proactively want to block hair loss. And finasteride has been discussed a lot in the media lately too, as just how dangerous it is. So you're inherently also blocking testosterone, not just DHT, but it is a form of testosterone. And there are issues with that, and post-finasteride syndrome, which if you Google it, it'll tell you that the percentage of guys who suffer from this is super low. But clinically, a lot of my colleagues see a lot higher anecdotal reporting of that, to where guys become pretty much almost impotent from using it. So it's not something that I recommend if guys are worried about hair loss. It's a touchy subject, because who am I to say, well, just shave your head, you'll be fine. It's more, let's weigh the pros and cons here of, not going on testosterone because you don't want to lose your hair. Okay, but these are the dangers of living with suboptimal testosterone. And so are you okay with that for the sake of sacrificing what your hair looks like? Like it comes across very curt, but it's an open, transparent conversation we have, because we have guys who have hesitated to go on testosterone because they don't want to lose their hair, and they have no idea if they're going to lose their hair.
Yeah, so there's a lot of factors to take into consideration there. And for the guys who I guess are, super sensitive to losing their hair, do you ever recommend things like topical minoxidil or like ketoconazole shampoo a few times a week, or anything that may, prevent hair loss when you are using TRT?
Yes, like it's still evil, but I guess it can be considered the less evil of the evils. But it's more so like, let's just wait and see what happens.
Yeah.
Usually it's not as dramatic as they think it is.
Yeah.
So, and they see bodybuilders too. And I'm like, listen, bodybuilders are on other things that do actually cause hair loss, like dramatically quicker.
Like what would those things be?
So, nandrolone, primobolan, those things tend to cause that a little bit quicker.
Anavar or Winstrol, not so much.
Not as much as Primo. And again, bodybuilders take very high doses of this too. So
yeah, I mean, TRT doses, I think most people are usually, 200 grams a week or under. I find a lot of people actually get benefits just with like 150 milligrams a week. I'm talking about, injectable. And maybe we'll talk about that now a little bit too, like injectable versus cream. So, my understanding is that when you're doing injectable, it's more of like a 10-to-1 anabolic to androgenic ratio. But when you're using the creams, it's actually, more like 5-to-1. So it's if you want to, have higher DHT and higher estrogen, which I understand there are, some very good benefits of having estrogen for men, like for your joints and that kind of thing. But, if you're looking more for the anabolic effects, you will get more of an anabolic effect and less likely actually conversion to DHT if you're using the injectable. So, I find that for most patients, they just prefer to use injectables because, it's just once a week, or I actually recommend twice a week. But, sometimes guys find that, when I go to twice a week, it doesn't really make that much of a difference. Now, other people find, there is a significant difference with that. But, what's the conversation like around saying versus using creams versus using injectables?
So if someone has an issue like with using needles, or they just don't want to use needles, or they don't want to travel with them, then going on the cream can be a great experience for them. A lot of guys do really well on it, but it has to be applied scrotally, not cream that you like put on your arm or something like that. Because the skin on the scrotum, it's 8 times more permeable. So it does have a benefit. And like you said, it does push more towards DHT, um, which can play a better role in sex drive. So if they have low sex drive, then that can be a benefit as well. So obviously, if you're applying cream twice a day, you have to be aware of when you shower, when you sweat, if you're having intercourse, if you're touching anybody after, there's those precautions you have to take. But injections really are the easiest. And it is the easiest to change the dosage too. If you do have to change your dosage, then any other delivery method like injections or creams are the top two that I would say do well.
And in terms of, the doses and the frequency for, test sip, I imagine that's the one that you use, testosterone cyprinate. That's one that you recommend to a lot of your clients. Do you recommend guys starting off once a week and seeing how they do, or do you just go straight to twice a week, or do you ever discuss a subcutaneous? Do you find it's just a little bit too tedious? What's your overall approach there?
Most of our guys actually start at 3 days a week because
3 days a week.
yeah, the more frequent, the more aligned with their natural release pattern. Some guys do every day, so they don't have to. It depends on what is going to be the highest compliancy. So if you can remember Monday, Wednesday, Friday, all right, awesome. If you struggle, maybe every day is actually better for you. I would say the least twice a week, absolute least, but 3 days is always going to be a little bit more beneficial. And guys who struggle, like, if they've got like if they have issues with very high hematocrit hemoglobin, we don't believe in having them dump blood all the time like a lot of clinics do. So then they may benefit from everyday injection as well. So those are reasons. It's contextual, obviously, with the person. But for injections, that's typically what most of our guys do.
And is that IM or sub Q?
IM, if they're doing well, it could be either one really. So using an insulin needle, and a lot of guys think it's like this big horse needle that they're going to be using to inject, and they're like, oh my god, I don't want to do that 3 days a week. I'm like, it's really little, like a 27 gauge 1 cc, like it's small. You may not even feel it.
So you do get guys to use just small insulin needles. You don't necessarily. Okay,
Yeah.
interesting. And I guess that probably makes them much more compliant overall.
Yeah. Especially
Yeah.
if like they don't love the idea of a needle. And then when they see the size of it, I keep telling myself I have to keep one like on my desk so I can show them like, look how big it really is. So that they're a little bit more comfortable. And I'm like, listen, if you hate it, you can switch to cream and vice versa. Like that's a thing. Some guys have done that. So
Have you noticed any differences in guys injecting intramuscularly versus guys injecting sub Q, or mostly they get the same results overall?
yeah.
Okay.
Yeah.
One big thing, people always want to know with regards to TRT is, should I be using HCG? And I find that this is one of the most mixed things on the internet with it. Like it's literally like 50-50 almost on who you ask. Some guys will recommend it and then other people don't. Like, what are your overall recommendations on HCG?
So there's 2 reasons that would be warranted. The first one is, do they want to conceive in the next 4 to 6 months? So testosterone does not cause like complete annihilation of sperm production, but it is thought to. If it actually did, it would be used as male contraception, but it's not. So it can suppress sperm production. So if a guy is not on TRT and he wants to or needs to go on TRT, he needs to get a sperm test done if fertility is something he is concerned about. Because that way you know where you stand before going on TRT, and you can't just blame testosterone for when you go on. And then you would do like subsequent tests throughout your time on testosterone to see, all right, has this impacted my sperm production or not? If he does want to conceive relatively soon, then the best things to bring in are FSH and HCG, because that will create sperm production within 4 to 6 months. That's what the colleagues that I work with, they prefer as a fertility protocol. So if a guy goes on testosterone, he's like, I don't want kids for like 2 or 3 years, he can go on testosterone only. And then when he decides he wants to conceive, if he can't, you can bring in FSH and HCG for the time period. Then, get your partner pregnant, and then you can come off of it. A lot of this I learned from my friend Dave Lee, and he has thoroughly studied HCG and different dosing, because there's people who think, oh, you got to do it at least once a year to like keep the lights on. And that does not seem to be clinically true. So guys have been told by clinics, you have to stay on it because they can sell it to them. Not necessarily true. The other reason to go on it is when guys go on testosterone, your testicles don't need to produce testosterone anymore, so they shrink. Some guys struggle with that. And I always say, like, we don't care as women. Like, it doesn't really matter. Women are not like, oh, I love a good tea bag. Like, I need a big ball sack. Like, it's my running joke. But we have one client who's like, my wife actually misses them. And I'm like, come on, you're like ruining my whole joke. But he's like, no, she does. And he went on it just for that. And I'm like, okay, fine. Like, if you want the testicular hypertrophy to come back and it means something to you, and especially in the gay community, apparently it does mean something to them, then that would warrant them going on it. But if I tell them, I'm like, if you don't feel good or you feel different or you feel moody or something like that on it, then maybe it's not great for you, because not a lot of guys do well on it. But anyone who says you have to be on it is lying.
And it also, too, is more prone to increasing estrogen than, say, just taking testosterone alone as well. So, that, can be an issue for some people, because obviously, like we, chatted about earlier, you do have to have, some estrogen in your body, whether, you're male or female, because it's really good for your joint health overall. But also, too, you don't want to have too much estrogen, because this can cause bloatiness and moodiness and all these other things. So do you ever have clients who, they use testosterone, and then all of a sudden they, start adding HCG, and then they do experience symptoms of high estrogen and they just don't like it?
So that estrogen is such a controversial topic in the TRT space, and it's very much discussed at my event, Silverback Summit in November, because I wish I could just take estrogen off my blood work panel, because guys will freak out if it's high. And I try to explain that estrogen measured through serum is not a true reflection of what is actually in a man's body, because it is not an endocrine hormone in men. It's a paracrine hormone, and it's produced in a different route. So guys will see it high, and then all of a sudden symptoms will develop. And they're like, oh yeah, I do feel this way and this way and this way. And then they think they're going to get gynecomastia or grow man boobs and all of that, where estrogen is not the only player in the development of man boobs. There's also other hormones. So explaining to them that having the conversion of testosterone to estrogen is one of the benefits of testosterone, because it is cardioprotective, it's joint protective, it's neuroprotective, to calm down, and it's okay, that you'll be all right, because we don't want them to take estrogen blockers. None of our clients take any of that. A lot of clinics give it out as candy when they see, oh, estrogen's high, we got to block it. And it's actually very detrimental to them. So that discussion comes up, but a lot of our clients know from my content and the colleagues that surround me that estrogen is a good thing. But when I talk to prospective clients or guys who just DM me about this, their understanding is coming from a different method or clinic who has told them you have to take an estrogen blocker. They don't really know why. And they actually end up feeling worse because they have joint pain, like you said, because they're just completely crushing their estrogen, or their libido completely tanks because it does actually help with libido, or they get belly fat. All the similar things that happen to women when they go through menopause, when they lose estrogen, can happen to guys when they block and suppress it. And it's one of the, I think we're coming around with a lot of the data, and people are realizing like estrogen's a good thing, and that the bodybuilding world created this mass fear of it. So clinically, I think we're getting there. But like, I live in South Florida, where a lot of clinics hand out the TRT starter pack, which is testosterone and estrogen blocker and then HCG. And I'm like, yeah, no, we need to not do that.
Okay, I want to come back to the estrogen thing in a minute, but there's one more thing I want to discuss with regards to HCG. So, do any guys complain that their semen volume is low, and that's the reason why they want to go on HCG?
Yeah, actually, we've had a few guys like that. And I'm like, again, like, is it porn or is it you? Because they always say, well, my wife. I'm like, no, she's not asking for bigger loads. Like, I'm pretty sure. But these
So,
guys, no.
and there are, I think, I don't know how, science backed there are, but there are some things that, you can do, I think, to increase, your semen volume if you, so desire to. I think lecithin is one of them. Just staying hydrated is good.
Yeah.
Alcar, I think acetyl L-carnitine, just having normal zinc. There are some things I think that can, maintain it somewhat if you are someone who's, I guess, insecure about your semen volume. So I just wanted to make sure that we got that one out of the way. But it's really interesting, though, what you're saying about, the estrogen. So when you're talking about estrogen blockers, like the biggest one that I hear of all the time is Arimidex. And, like you say, or like you hear, like from a lot of clinics, like, they put people on these three drugs: testosterone, HCG, Arimidex. And so Arimidex, for people who don't know, is an estrogen blocker, and it's a aromatase inhibitor. And the doses that people use are quite high. Like, it generally even only comes in 1 milligram that can be split into, maybe 0.5 milligrams. Then you'd have to do sort of the splitting on your own, which gets, quite tedious for some people. And like, I've heard people like, Dr. Peter Attia say that, like, if he prescribes estrogen, it's like, or sorry, Arimidex, it's like 0.1 milligrams, which is obviously like a tenth or like a fifth of what a lot of guys are getting. And so when guys, get this, massive dose of an estrogen blocker, it can, wreak havoc on their joints, wreak havoc on their mood. And like you said, too, I think a big one that guys don't realize is that it's important for your sex drive. Maybe you can talk about that a little bit, because, guys think that, like, testosterone is the all powerful hormone for my sex drive. Estrogen is a thing that's like going to kill it. And so maybe we can kind of put that myth to bed here today.
Yeah, they get told, like, it causes ED and causes all these things, and it's not true. And it's wild, just the data. Like, the main doctor that taught me a lot of this is Dr. Jordan Grant, and I have him talking at Silverback specifically on the deep dive science behind estrogen in men, because we've talked about it every single year, and it's a lot of the same questions about gyno and ED and all this stuff, and even the use of AIs. And I was like, this year, I just want you to go into the science and the deep dive behind that, because it is still highly misunderstood. So if someone comes from a clinic where they're on an anastrozole, I'm like, this clinic does not know what they're doing, because even if it's just a little bit, like, there's really no reason. Usually it's because they're on a once a week injection, and then they measure their labs like a day or two later. And then, of course, estrogen is going to be super high, just like testosterone. So then they freak out. They think it's a problem. So it's more so because they're on a very poor protocol and things aren't managed properly that they have maybe symptoms. Jordan will say there are no high estrogen symptoms. It's more so if someone's insulin resistant, they're going to feel said symptoms a lot more, which is also a reason for somebody, if they're overweight or if they have a lot of body fat to lose, to start on cream, because it will push more towards DHT and not cause what is typically associated with estrogen, which is the water retention and the moodiness and all of that. And then if they get leaner and they want to switch to injections, they can, because they won't feel the aromatization as much in a negative way, even though it's a positive thing happening. The guys will not associate it with that. So it's such a debated topic that, anytime I've done a video or collabed with Jordan or pulled a clip of him talking about it at Silverback, we get so many trolls, and it's great because then it creates awareness for people to understand. But there's still people that are like, well, I have to take Arimidex because otherwise I feel awful and blah, 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 blah. And I'm like, cool. I've also seen clients who have been on Arimidex for ever, and they're taking like 3 grams or 3 milligrams a week. And their DEXA, like their bone density is terrible.
Yeah. And I'm sort of just thinking out loud now, like I never thought of this before, but like, there have been a lot of studies, thankfully, that have shown that, TRT doesn't increase the risk of, cardiovascular disease. But I imagine like, the people who are taking these high doses of, Arimidex, I mean, that's just going to kill your HDL. And so, that's really not good for your overall, cardiovascular health. And, that's the reason why women, for example, below the age of 50 or 55, they have significantly less heart attacks than the men do. Now, when it gets past 55 and gets older, it does seem to, even out a little bit more. And that is because estrogen does have such a cardioprotective effect. And that's why you see women have, much higher HDLs. I mean, it's even on a standard blood test. Like there's even different criteria for men and for women. And I hate how we have different values in Canada and, in the US, but like, on the Canadian value, and sorry for the Americans out there, I know it's, at least 1.3 millimoles or greater for women for HDL, but then for men, they only want above 1 millimole per liter of HDL. And so, it's a major cardioprotective thing. And, I'm glad that you're chatting about that today.
Yeah, because it is like estrogen is anti-inflammatory. And so the reason why people who are overweight make more of it, because there's more aromatase in fat tissue, is because fat is an inflammatory tissue. So the estrogen is being ramped up to protect the body against it. And that's why the insulin resistance is associated with it. Whereas if you actually just got leaner, this would not be as much of what you're creating it to be a problem.
Yeah, that's a really good point, actually. And, I'm glad you brought that up, because I don't know, maybe I have, but I can't really recall ever discussing that on the podcast before. So, if someone has, a lot of fat tissue or adipose tissue, you are going to convert more of that testosterone to estrogen, because there's a high activity of, aromatase in fat tissue. So yeah, really good point. I'm glad that we mentioned that. One thing that I wanted to chat about, and this is, kind of difficult to test, and, I actually haven't had this done before, but I do want to look into it. My friend, Dr. Kyle Gillette, I'm not sure if you're familiar with him. I think
Yeah.
he has, okay, yeah, I think he has a test out there to test for androgen receptor sensitivity. And so, some guys, maybe they're taking higher levels of testosterone and they're still not getting, the results that they're looking for. And other guys maybe just need a smaller amount and they get great results. And it could be related to this thing called, androgen receptor sensitivity. And so from my understanding, maybe you have some, other testing, available that I'm not aware of, but I think, Kyle has some kind of lab that he's connected with where he does CAG repeat testing. And I forget which one it is. I think it's the more CAG repeats you have, the lower your androgen receptor sensitivity. And then the higher the less CAG repeats you have, the higher your androgen receptor sensitivity. Again, I may have got that one wrong, but I think that's correct. But is this something that we can test for, or is this basically just something that you have to, do clinically overall?
It is a relatively new test. The clinic that I work with, Merrick Health, they do offer it. They're actually going to send me. It's an at home test. I think it's saliva based actually. So I forget what, like, the results, how you read them. I haven't had any clients do it yet, but they were telling me about it. They're going to send it to me so I can go through it to understand. It sounds cool. It's one of those things that, like, all right, I want to wait and see, like, you know, is it useful? Is it not? See other people go through it, because it's not cheap. So it's definitely interesting because, yes, there are guys who need higher doses, or like I call like the no man's land when a guy say he's like, around 200-300 total tests, and then going on TRT brings him to like 800 or 900. He feels okay, but it's kind of like when you're trying to do keto, but it's really low carb. So you're so low carb, you have no energy, but you're not necessarily low enough where you're actually in ketosis and it feels good. Like, so you're kind of in this no man's land of like, I don't feel great, but I feel better, but I'm not sure where to go next. They may need more testosterone to push them into the 1,000 or even higher to actually feel good. And I think that's where that test is warranted or needed. But I think the clinical outcome will just be the same as going higher. But again, there are clinics that are different where they'll say, oh, well, if your test is at 1,000, we have to lower it. And they have no reason why other than the fact that 1,000 is scary to them. So it would be
Yeah.
more for those clinics to show like, well, actually, this guy feels best at 1,200. So, you know,
Yeah, hopefully we can just get like a blood test or something that we can, just identify this with. Because I imagine too, it would change with, diet supplementation and that kind of thing. And again, shout out to Dr. Kyle Gillette again, because he was the one who told me about Alcar's effect on androgen receptor sensitivity, so acetyl L-carnitine. And now he also said that, like, unfortunately, like, taking it orally, it's not useless, but it is very, very poorly absorbed. And so you can get injectable acetyl L-carnitine. Is that something that some of your clients have, used, and have anyone gotten like really good results with it, or even with like oral L-car?
so we have clients who've tried L-carnitine injectable. We've had guys who maybe they don't necessarily need or want to go on testosterone just yet, and then they'll use L-carnitine as something to help increase androgen receptor sensitivity. I personally have not seen it really do anything for that. I've not seen any real difference where guys are like, oh my God, this is amazing, I don't need to go on testosterone. Like, nothing works as well as testosterone, like the actual hormone. So
Yeah, that makes sense to me too. But I am interested to see what happens with all this androgen receptor, sensitivity. Maybe there will be, a test that comes out that's is helpful overall. But we'll
yeah.
see too, because again, it's hard to treat, and from my understanding too, like injectable acetyl L-carnitine is also very expensive. So I don't know how like viable it is like long term for a lot of people.
And
So
it's intermuscular. So, and you have to inject a lot at a time. So nothing's
yeah.
comfortable.
Yeah, I hear you. I've done like NAD injections, and sometimes they can be I tolerate them pretty well, but I mean, when I've had some IVs, like sometimes it's like, holy shit, you need to slow this down because you can get like just super uncomfortable. Like it's hard to explain what that feeling is like. All I can really like it's like it's kind of nausea. It's just like I
Yeah.
just feel uncomfortable. I don't really know like how else to explain it other than that. Have you had those done before? NAD injections or?
Yeah. I have it in my fridge. I never use it because, like you said, it's just, you just feel weird.
Yeah.
So it's like, am I going to like fall over flat on my face or am I going to throw up? I don't really know.
Yeah, it is a very, very weird sensation, like, I don't know how else to explain it other than just it makes me feel uncomfortable. So I think we've covered everything pretty good on TRT, but is there anything that we may have overlooked that guys should be looking on their blood tests maybe that we haven't covered today or
Um, no, I know in Canada it's like way harder to find competent practitioners. So, it's
Yeah.
because I don't know any. I remember last podcast I got a lot of messages asking, and there's really only one clinic I know in around Toronto, but other than that, I don't know a lot of Canadian practitioners. I'd say just come fly to the US and get your blood work done.
Yeah, I mean, I've only exchanged messages with Derek from More Plates, More Dates, like a couple times briefly.
Yeah.
But I know he's trying to do something because he's Canadian himself. He's from Vancouver, but I think that he's just encountered too much red tape and just not really possible there right now. But maybe that'll change in the future. Maybe it won't.
I
Um,
know. A lot of people are like, can Merrick come to Canada? I'm like, it's not that easy, even though the owner's Canadian. Like,
Yeah, I know. Hopefully it does change. Let's maybe chat about training a little bit. So, obviously, you do a lot more than just, educate guys on TRT. You talk to them a lot about their training. And so, do you find there are some guys that come to you that are doing like way too much cardio or way too much volume work? Are you more of like, try and do, 3 to 4 days, say, of like strength training, then just do strictly like zone 2? Or what's sort of like your, you know, overall approach to for guys who are training and want to maintain a good physique?
most guys, it's either they do like the 5-day bro splits with zero cardio, or they come from like the circuit training, CrossFit, F45 type of world where it's super intense, short workouts, like no rest periods. So you want to kind of find the happy medium. A lot of the times we switch guys to like 3 or 4 day splits, and then they're like, oh my God, is that enough? Like, am I going to be okay? Yes. A lot of guys need to do cardio, need to do zone 2 that they just ignored, or they don't like doing it, or they think it'll make them smaller.
Yes, explain that really quickly with the zone 2, because I know that's a massive thing. Guys think that like if they do cardio, they're going to get skinny. And from my understanding, like when you do something like zone 2, it's the exact opposite. And for people who don't know what zone 2 is, it's basically training at 60 to 70% of your heart rate max. If you want to calculate that exactly, you can, get trackers and stuff like that. And just one quick tidbit there on that. So I have an Aura ring for people who are watching this on video. I actually found though that it may not be as accurate for heart rate. Like it does give you your heart rate and your zones, not continuously updating. I think it's every like 5 minutes. But I just got a Coros monitor, and that's a one that I like updates it like continuously, and I think that is a little bit more accurate. But anyways, I'm kind of jumping all over the place here. Just let me know about zone 2 cardio and why guys shouldn't be afraid of it and why it's not going to make you skinny.
So, like, if you're training for like ultra endurance events and you're going to run across the continent, then you may not necessarily be as muscular as you want. But that's not what we refer to when we tell guys we want them to do aerobic work. And I say aerobic work is like anabolic. And then they're like, well, what do you mean by that? And I'm like, okay, the more conditioned you are aerobically, meaning like zone 2, upper zone 1, like super mindless, easy cardio that takes more volume to do, because the lower the intensity, the higher the volume, the more red blood cells you make, the more mitochondria you make. And the mitochondria that everyone learned is the powerhouse of the cell. That's where food is basically manufactured into energy, to put it very easily to understand. So the more conditioned you are, then your body will say, oh, cool, like fat and carbs, I could actually use those and properly dispose of it to create energy. Therefore, you can lift more, train harder and longer, but you can also recover quicker in between sets, but also in between workout days. It helps you bring blood pressure down. It brings resting heart rate down. It allows you to sleep better. And all those things can contribute to muscle growth. The problem is people will jump into like hit training or something super intense and they don't have that base or platform of aerobic conditioning. And then they suffer and they don't feel as good. And maybe they don't realize that, yeah, actually getting fit that way, and I'm not going to have my muscles fall off, and it helps me perform better, and I can eat more because my body is actually like using the food that I eat. That's a huge benefit to what they want to look like and muscle growth and all that stuff. So it's a great tool for fat loss, but not in the way that a lot of people think. They think, oh, I got to lose fat, got to do 2 hours of cardio. Not necessarily, but if you are more conditioned, it will make it easier because you are fitter, not necessarily just to make it a calorie funnel. So it'll actually make everything else happen a lot better.
Yeah, I've noticed two big things from doing more of it. The first is like, when I do my leg day, like, leg day is kind of like a cardio day if you're, doing it pretty hard. And I find that it's easier now that my, zone 2 cardio is better and I have a better base. And then I'm still doing, MMA hard at least once a week, and do, quite a few like, rounds of sparring and things like that. And I definitely recover faster between rounds. Like, I'm not saying that like my all out like output when like during the round is better, it's probably not, but I think that like I do recover faster between the rounds. So the second round, the third round, the fourth round, it does make it quite a bit better, which is just a massive like advantage. And then in terms of like how much someone should do a week, Ali, like do you recommend like 2 hours a week, like 60 minutes, 2 different sessions, or like what's sort of your overall approach there for your clients?
Like if we can start with 30 minutes a day, that is fantastic. And it doesn't have to be all at once. You can break it up. If someone has 90 minutes a day, at least initially. So if someone's really deconditioned, it'll take 8 to 12 weeks to just get the adaptations you're after, but then those stay for a while. And then you can sprinkle in more intense stuff to maintain that. But initially, 8 to 12 weeks is not going to make you look skinny and look crazy. If you can get 30 minutes in a day, cool. If not, okay, let's see how many days we can. And then maintaining that just for heart health too is a benefit. So a lot of people don't realize that because we didn't really talk about that, but there is something to, I don't know, keeping your heart running efficiently that kind of is a benefit. So if people can work it into their day, then amazing. But that's also where if someone's very overweight, very deconditioned, lifting total body 3 days a week and then getting the cardio in on the other days can be a massive driver for their success and potential down the road. Then they can switch to maybe 4 days or 5 days if necessary. But that's always a worry is guys are like, well, how am I going to get it all in? Because I'm lifting 6 days a week. And I'm like, well, you don't need to. You could lift like 3 and then you won't like shrink. And they're like, oh my God.
Yeah, I also think that as well, like even 3 days a week is fine for like maintaining like a really good physique, provided that you're eating 1 gram of protein per pound per day, and then obviously maintaining your hormones. And if you do those 3 things, which in my opinion are the 3 biggest anabolic signals by far, resistance training, protein, and then optimizing your hormones, then like 3 days a week of resistance training should be sufficient. One thing I know we don't have too much time left here, but I want to, maybe I can kind of do 2 things in one here. So you had a pretty interesting video the other day about, when guys meet you and they have this weak handshake, just sort of like this total turn off. I'm also thinking though, what about like poor posture? Because poor posture I think also may be a big turn off for people. And when you're optimizing guys programs and like I'm doing this now because I feel like maybe I've done more pushing than pulling and throughout my life. And then also too a little bit like quad dominance. Like my leg workout now is almost entirely like glute based for the most part, or posterior chain based at least. So first question is, do you find that posture is just as big of a turnoff as the weak handshake? And then the second question would be, when you are, looking at programs for guys who, do have poor posture, do you really emphasize like a 2-to-1 pulling to pushing ratio, and then also, doing more like things like, like hip thrusts with like the Mark Bell lateral bands? Those are the ones I use to really like activate the glute med and min, so that don't have like, you're not kind of like waddling when you're walking, basically.
Um, if poor, like if I see someone with really bad posture, I can't say I'm like, oh my God, I'm repulsed by them, but it's not like attractive. A weak handshake is just like, come on, like just lose like all trust. And I'm just like, ugh. Uh, I'm not alone with that. Like it's very similar to the message that I talk about is like if you're fit and you look the part when you walk in a room, like people notice.
For
You
sure.
you have a presence, you command respect without saying a word. So it kind of goes in line with that. Whereas usually people with bad posture don't command the room like that. So probably inherently, yes, it's not attractive. Um, and then when guys are struggling, if they have postural issues, but they're fit, and it's usually having to do with overdeveloped muscles or underdeveloped muscles. And then, yeah, we'll work around that because a lot of guys do have fucked up shoulders from probably only flat benching for far too long. I did a video on that too. And it's amazing the comments that I caught about why is a woman telling a guy how to get a big chest and like all these things, because women don't have pec muscles apparently, and also the stupidity that comes along with people who troll me. But they're like, oh, all these guys got big chests by benching. I'm like, I'm not saying don't bench. I'm saying don't only flat bench, because your shoulders get used to that only if you actually incline and work all the ranges. Guess what? You have healthier shoulders, but people who don't realize what I'm talking about yell at me. So that's the internet, but it's okay. But yes, we have guys who, sit at a desk all day and then end up like this, and we'll work around that.
Yeah, there's a couple things I do now to fix that, like the lateral, like just like bands, like pull aparts. I find those to be, pretty effective for activating like the lower to mid trap muscles, which I think, are under trained and weak in a lot of people, for pulling back the shoulders. Scapular wall slides, are really good.
Yeah.
You do have to have good mobility for that. So if like your shoulders are messed up, one thing too about the bench. So I like almost exclusively now just use a Swiss bar, if I'm doing any benching, just because it makes, it's easier on my shoulders. Is that something that you recommend to some of your clients, or?
Yeah. Cause like one of my private clients played football, just can't really bench press flat. So I had him order one of those. A lot of our guys will use those. Yeah.
Yeah, I do those. And one thing I find too that's really easy on my shoulders is one arm floor dumbbell presses. Obviously you're not getting like the full range, but the other thing there too is that it's good for like if you're in mixed martial arts and you want to push someone off of you, like you obviously don't go back further than the floor. So
yeah,
it's a really good exercise for that. But man, I wish we had more time, because there's so many other things that I wanted to ask you here today. But anyways, that's why you're a returning guest, and I'm definitely going to have you back on if you're up for it.
of course.
So, before we leave, just tell everyone where they can find you, where they can learn more about your coaching, maybe a little about your upcoming documentary and anything that you're doing.
At the Ali Gilbert, ALI, on Instagram, and you'll find all the links in my bio for applying to coaching, to Silverback Summit, which is my men's health event this year in Orlando, Florida, November 13 through 15. And it's basically all my trusted TRT practitioners, fitness, nutrition, business, men's health, everything in one room. Yeah, that's where you find everything.
Awesome. Well, thanks so much again for coming on the show. We did, like I said, we got through most of the things that I wanted to get through, but not quite all of them. So, hopefully we'll get to have that conversation another time. But congrats again on, everything that you're doing. And, I'm sure that summit in Orlando is going to be awesome. And for anyone who's in the States, definitely reach out to Ali. She definitely knows what she's talking about. She has awesome, reviews with all of her clients, and they seem to be super pumped with her. And, I'm not really surprised at that. And of course, thanks everyone for listening. And as always, I'll be back with another episode soon.